Welcome to Healthcare Ops Wave. It's not only an acronym for how, but also healthcare operations and waves are actually very similar. Both are steady, run in cycles, and have the odd storm in between. I'm Frederik Mueller. I'm the co-founder and CEO of Third Way Health, and we'll bring you the stories that shed an inside look on the humans behind healthcare operations.
Hello, welcome to another episode of the Healthcare Ops Wave. And I am extremely excited to be here with Jamie Reddick. Jamie, thank you for joining us and welcome. It's your first podcast.
Yeah, I'm excited to be here and curious to see how this is going to turn out since it is my first podcast.
Yes, you're gonna do just fine because I think what ultimately got me super excited to have you on this show is that you have a wealth of experience in healthcare operations, and ultimately I think that's kind of what we want to use this time to shine a light on. But we'll start easy. Can you tell our listeners a little bit about your background and how you ended up in healthcare in the first place?
Sure, good question, because that's what everyone wants to know usually. But I'm currently in a chief operations officer position for a large medical group in San Diego. We have about 106 physicians with a focus in primary care. But I've actually been exposed to healthcare since I was a freshman in high school. So I attended a STEM school that focused on healthcare professions, and my very first job was actually as a medical records processor in an urgent care. I did realize really early on that blood made my legs feel a little bit like Jell-O, so I knew that clinical care was definitely not my path. But I was super fascinated by systems and the coordination of patient care behind the scenes. So when I graduated high school, I went on to get my bachelor's in healthcare administration from Cal State Long Beach and ended up here where I'm at today. Mind you, there was a long journey along the way, but I'm happy to be where I'm at today and doing what I do to help patients at the end of the day. And I think that's the most important thing and kind of the question I always ask myself when I'm about to do something or make a major change is, what's the impact on the patients, and is this the best thing for their care?
Let's unpack that a little bit. You started at Graybill 1.0, right? And we'll get into, because right now it's Graybill 2.0. Where did you start at Graybill?
Yeah, so I actually started with Graybill as just an office supervisor. Prior to that, I had been a billing manager for an ophthalmology group, and before that, an office manager for a physical therapy office. So I had some exposure to different specialties, but Graybill was definitely the largest group I had kind of stepped into a role for, and I just worked my way up. I've worked in several different areas within this group. I've overseen call center, I've overseen quality assurance, I've overseen patient satisfaction. So I've kind of been everywhere you could possibly be within this organization before where I've gotten today, which is in the COO role.
Yeah. And so I'm curious, one of our questions that we like to ask every guest is, how do you see operating models, decision-making, communications evolve in case of a growing organization? But I'm curious, what is your perspective on this as having been in the operator's seat and then kind of going, continuing to climb up the ladder, quite frankly, right? Like, there must have been a few insights and lessons learned on operating models and how you change and scale yourself along the way. I'm curious if you have a few can share a few thoughts on that.
Yeah, I'm a big proponent of trial and error. This group particularly, and it's all relative to the environment someone's in, right? But this group particularly has gone through several different shifts. There were a few key shifts where we joined a medical foundation. We had to integrate into a much larger centralized model, or kind of try to do that while still kind of maintaining this culture of you can have it your way. We called it the Burger King model. And that kind of meant adapting to workflows and technology that weren't always built for how we operate. The kind of thought process of our administration at the time was to use a lot of consultants or external folks. So I had to pretty much become the subject matter expert on everything and anything we did, which really helped me because I had a lot of hands-on exposure to areas that I didn't have experience in the organization with before. But then in turn, I was constantly kind of telling people, hey, this is how we do things. Like, what can you recommend that will or won't work for us? And then most recently, the group terminated its affiliation with that medical foundation, and we had to reestablish everything. So that meant from IT, like telephony, patient access systems. And so that return to autonomy was kind of a major inflection point for me, and it forced us to intentionally think about how we wanted to design our operations today that served both our providers and our patients. And so that's been really exciting because we're really working from like the studs up right now. And so it's a cool experience.
We use this term, you've said it before in conversation, 93-year-old startup, is that right?
Yeah, so we say the 100-year-old startup.
100-year-old startup, that sounds much better.
Yeah, technically we're 93 years in business, so we've got history and legacy, but we're rebuilding so much more than that right now. So it's very rewarding and just cool work, especially because, like I said in the beginning, at the end of the day, that constant question is, am I doing what's right for the patients at the end of the day?
With the opportunity to be in the 100-year-old startup, and as you said, you had to establish your operations from the ground up. What did you do differently than what you've seen in the past? And like, what were, I don't think there's many people that have the opportunity to, like rebuild what has been in the framework of an existing organization, which is really cool. What were some of the changes, things that you did differently, and what were some of the things that you just continue to do because you saw that they worked well, right? Again, from how you structure teams, communicate, organizational decision making, etc.
Yeah, there's several examples I can think of off the top of my head, one being the partnership with Third Way. But I think as I strategized around how we were going to move into this new adventure, let's call it, or journey as an independent group, I was thinking of, I had the opportunity to kind of see what wasn't working and scrap all of that. Whereas when I was living it before, I didn't have the necessarily the ability to do like a mass reduction in force because I wanted to outsource the phones. I think I did have to be a little bit more measured with outsourcing because we are a smaller group, and I wanted to make sure that we had the right balance between like control and efficiency. And so we were really careful when outsourcing certain things and or centralizing certain things to make sure it was going to be beneficial to our providers and again the patients. So we did things like prior had a centralized utilization management team. We brought that back all into the offices so that we could have that kind of closed loop form of communication between the providers or the providers and the staff and the patients, so they knew kind of where they were at in the process. We also did the same with medical records because there was a lot of inefficiency with currying papers to a scanner and, a lot of back and forth there. So we took the opportunity to kind of analyze our operations on a whole, see what was working for us, what wasn't, and then also looked at trying to outsource what we could. When we were looking at outsourcing, it was really important for those vendors that we were partnering with to become a true extension of our teams and fully integrate into our operations as well.
That's super interesting, and I want to maybe unpack that a little bit more. So things you did differently is utilization management used to be centralized in like their own space, and you like brought them basically to sit much more closely to the rest of the organization, so they're more integrated. That's really interesting. How's that been going? And I think utilization management is such an specifically in the world of managed care, right? It's like it's such a key function, and we have a lot of conversations with people about it. And some of it is outsourced. Some people outsource it, especially on the plan side. I feel like there's a lot of strong convictions on doing that, and I hadn't actually heard that. Like, how has that been going for you guys?
I think the general feedback from the providers and the staff have been fantastic so far. People really like the ability to go walk down the hall and say to the referral coordinator, hey, I submitted this referral for rheumatology last week. Can you tell me where it's at or if it's approved? I also think there's more opportunity for integration or communication between the medical assistants and these referral coordinators, and just making that true care team where the patient's getting that high touch, like patient centered experience that we're trying to provide.
Yeah, totally. And I think that's so powerful because utilization management is so closely connected and not always black and white. So I can really see that as, I think you said it nicely, the care team. I'm curious on medical records. So what was it like before, and like what led you to make that change? Because I think that's another one that's really interesting. There's a lot of vendors that actually just say, we will do medical records for you, and I'm curious to understand the path that you've taken there a little bit better.
Yeah, and so to clarify on that, we kind of have a hybrid model there. So we did outsource our ROI. We're using a vendor for that because they're able to scale that. Our EMR system is a little clunky, so the process is quite lengthy. So we're happy to outsource that and be able to provide that level of service externally through that vendor. But internally, I think the reason for decentralization was because we were consistently backlogged in getting those records into the patient's chart, specifically scanning. And I didn't touch on this earlier. We had gone through a cyber attack last year where we were on actual paper for 6 months. And so during that 6 months, you can only imagine how much paper truly backed up and kind of almost got lost into an abyss. And so we've been able to decentralize that, clean all of that up, but then also maintain all of our medical records processes for current information as well. So we've seen great improvement in satisfaction around that and higher turnaround times in medical records processing in general.
Excellent. So I think you touched on this a little bit before, and I'm curious, how are you outsourcing? Was certain aspects of what you used to do in-house was also one of the changes in the 100-year-old startup. And, full disclosure for everyone in the audience, Graybill is a valued partner of Third Way Health, but we're not your only vendor that is an external operations partner. And so I'm curious for your perspective on how you think about what you would outsource versus what not, and what advice would you give to others? And then also, what can vendors do, right, to really stand out from your experience, from your perspective? Because you mentioned you want vendors to be a true extension of your team, and so I'm curious if you have some thoughts on that as well.
Yeah, so I think first steps is kind of evaluating your core functions and determining like what that looks like. For us, it's providing patient care. So we can't necessarily outsource our MAs or our providers to anybody, but our non-core functions like our call center or medical records release allows us to partner with a vendor that's going to provide better service, provide redundancy, because that was a huge issue with us, was turnover in previous state, and be able to be that extension of our team. I know for us, we are a smaller group, so again, we kind of want to look at the control and efficiencies of these vendors, but at some point we're going to try to scale, and so we are able to do that with an outside vendor and not have much like impact on our internal operations. I think for organizations really depends on governance and how well you integrate and manage that vendor as part of your operational fabric. But the ones who stand out are the ones that, like I said, understand the complexity of healthcare operations. They're not just selling a product, because I've had vendors that have done that and I've felt the frustration of being a number in their system. These vendors offer a solution and they walk alongside you through the inevitable bumps. The best vendors I've worked with, like I said, they're flexible, responsive, and they treat our problems like they're their problems. So those have been kind of the things I've seen in partnering with the vendors that we really like to work with.
What guidance would you give to folks that are not really outsourcing much today and are thinking about it, sort of best practices of managing and partnering with outsourced vendors?
Pilot if you can, because then you can get a sense of the vendor, how they're going to function, their responsiveness to you and your team before kind of putting that out to the entire organization and patient population that you serve.
What's one of your greatest successes across all the stages from where you started in medical records to where you are today? Is there a top one? Can we pick a top one?
I can tell you the thing that I'm probably most proud of, and I walked into my CEO's office the day it happened and almost in tears, but tears of joy. But one of the biggest challenges and successes was during our transition out of the foundation. So as I kind of touched on before, we had to rebuild our infrastructure from scratch. We weren't going to have a phone system. We weren't going to have EHR access, no billing platforms, like access to any files that we had before. Our network guys were in here working like 24 hours a day to rebuild our IT infrastructure. And we had to do that all without disrupting patient care. So it was a lot of nights and weekends spent trying to do this work. But within weeks, we stood up essential systems across multiple sites. We have 10 office sites that we kind of manage, and we maintained that continuity. It was definitely a team effort and a reminder that leadership in operations means that I have to remain calm in the chaos and laser focus again on the patients.
That is an incredible achievement, and something that is also somewhat doesn't get as much attention as it maybe should, is something simple as you need internet. Like, actually, that all has to be in place, and to do that across, at a certain scale.
Well, yeah, or being able to call one of our offices and get through to an agent on the other side,
Yeah.
I think people fail to realize, they think they speak it into the air and it just happens, but at the end of the day, there's a lot of work that goes behind some of these items that I kind of just touched on.
Yeah, no, excellent. This is one of my favorite questions because whenever I ask this, I don't fully actually come up with a good answer myself. But how do you describe your job to people outside of the industry?
So in short, doctors take care of patients, I take care of doctors. But if you need a little bit more elaborate answer, I just make sure our doctors and staff have the systems and tools they need to focus on delivering the care. So if you ever have a smooth visit at a doctor's office, that's the kind of experience I work to build behind the scenes.
This is not the first time you've said this. That is as succinct, as good as a summary as I've ever heard. Now, you are up and running. You are, really in charge of operations at a fairly significant scale. You say that you guys are small, but in the relative sense of the healthcare system, you're a big organization. So what are the main things that you look at on a quarterly basis and on an annual basis? How do you make sure that everything is running the way it's supposed to? What do you look at?
Yeah, so I think that's a good question, given that we're this 100-year-old startup again. Right now, I'm really focused on operational stability. So things like patient access, staffing, compliance, like we had to rebuild our whole policy and procedure library, and system uptime, because I think one of our biggest points of dissatisfaction was our IT team and the amount of downtime we had. So I think we're making great strides, but it's something I want to continue to monitor so we become that well-oiled machine. But then as we talk about long term or year over year, I really want to focus on strategic alignment. So where we're going, how we're going to grow, how we build infrastructure that's going to last long term. And so it's kind of a mix of fixing what's urgent or putting out the fire in front of you, and then planning on what's important and what is going to be the best decision for this group down the road.
And so to do that, what are the main KPIs that you look at on an operational basis?
Yeah, so with patient access, we're looking at things like longest hold time, abandonment rate on our phones, when our first third available appointment is. We're looking at things like how many patient hours are providers providing care, and kind of memorializing that so we have a sense of then the bigger picture growth opportunities and where we need to hire maybe more physicians to provide that access. With staffing, the big thing is turnover. We want to make sure we're building a culture that is positive and that we keep our staff, the ones that
Yeah.
we work so hard to hire and bring on board. And then, I think with all of that too, we're looking at things like population health metrics. We're looking at patient satisfaction scores through our survey vendors, and then how we can improve on those year over year and implement the best ways to kind of achieve our goals, but do that so that we don't experience things like burnout from the provider side, because you see that as a huge prevalent thing in healthcare nowadays, especially since COVID.
Yeah, no, I love kind of hearing what KPIs people look at, because what is interesting also is, you talk about population health, right? In your world, managed care is very important.
Yes.
And so those are obviously metrics that someone purely in a fee for service world wouldn't look at. But the interesting thing is always finding this middle sweet spot, right, between operational efficiency, allowing providers to have autonomy as much as possible, and then doing right by the patient, right? And it's like it's always, you kind of gotta keep the puck somewhat level between all of those 3 points. So it's maybe the unseen day-to-day life that many operators live.
Yes, and when you talk about KPIs, I feel like with managed care, there's hundreds of them that I'm always looking at, right? Because we're servicing different patient populations, because we're dealing with ACO, we're dealing with HMO, we're dealing with service HEDIS, and so there's all these different sets of KPIs we have to kind of bring to people's attention, and so that's always kind of not a struggle to manage, but just interesting to try to kind of convey to people as we're getting buy-in for why we're doing something.
Yeah, excellent. So then looking forward, if you believe it or not, we are a little over a third, I think, into this year. Time flies. But then if, we're looking towards the end of this year, next year, for other operators, what do you think everyone should pay attention to? What's one thing that everyone should pay attention to in the next year?
Well, if you've talked to me in the last year, I will tell you that AI is here and it's not in the future. So internally, we're using it already to improve coding accuracy, and almost 100% of our providers who were using human scribes before have now transitioned to an AI-powered scribe. So it's definitely been a game changer for efficiency and reducing provider burnout. But I think there's so much more that AI can contribute to in healthcare that people are not tapping into, that it's definitely something to look out on or look out for and educate yourself on to see, because it's just astonishing to me what it can actually do.
What are some of the things that you see as unrealized opportunities for AI in healthcare today?
I think that there's a huge opportunity we've looked at different platforms that offer AI bots. The reason we haven't adopted them is because they're a little immature in that you have to kind of have an engineer that manages those, but we've seen them actually scrub charts, send tasks, and kind of prompt providers for things that they may have missed in terms of like diagnosing or HCC coding or things that kind of just they're missing because of that fatigue they're experiencing from seeing it and then the medical decision making that they do all day long. So I definitely think that there's opportunity there, and that would actually reduce labor for us significantly because we are paying people to do this kind of work today. And then also, I've seen IVR or AI, like I've seen call centers running on AI recently. I don't know how that would go over with our senior population quite yet because I haven't tested it, but it's definitely interesting.
You know what is interesting is there are different starting points for people to go to AI, and I think some of the use cases like chart scrubbing is a great starting use case. On voice, obviously, it's interesting. I talked to some people that are all in and they want to do it. You know, others that are saying, look, I don't know how my providers would like this. And I think what we always see in respect to that is technology is one side of the equation. That's just an enabler, right? It's how do you gain comfort and align that with your operations, and that's kind of where it gets tricky, and not everyone is on the same space. But I think we share your excitement around where this can go. Let's see, 2 more questions. So what is your favorite healthcare statistic?
So I'm going to kind of shoot myself in the foot with this, but administrative costs make up 25% of actual healthcare spending in the US, which is huge. So it's just a constant reminder that you have to continue streamlining operations. It's not just about efficiency, but you have to sustain that process and be able to continue to scale it as you grow.
For all of us in the administrations and the administration roles, that is maybe one of the statistics that is most often cited by providers as well. So totally agree. There has to be a good balance found. Well, lastly, what does a day in the life for Jamie Reddick look like? What, if you look at your calendar, what are some of the meetings you held in this week so far?
Yeah, so if I'm looking at just this last week, it's a mix of strategic and operational work. I'm a huge proponent of being involved and understanding a process so then I can make recommendations or speak to someone who's having an issue with something. So last week, I had a bi-weekly status call with our EHR vendor, NextGen, just to check on implementation progress because we are still kind of working through our migration onto our own EMR and getting things up and fully functioning again. I met with a provider directly to kind of go over her protocol within her office, just to kind of fine tune those care pathways that she's just having a little trouble with. I had a strategic planning session with an outside vendor focused on open enrollment, where we discussed kind of eligibility workflows and how to align communication touch points. I also had a design session for our radiology interface, which is going to help us streamline orders and result workflows between our system and theirs. And then on the ops side, I like to close out each week with a weekly huddle with my practice managers. So at that huddle, we kind of go through wins and, challenges. It's an open forum for them to ask questions or kind of work through problems they may be having in their clinics, and it gives me the ability to update them real time as changes are being made, so then they can have that downstream communication to their teams. So it's a really productive meeting for us, and I always love to end my week in that capacity.
Oh, we used to have a similar meeting. We would call it the weekly retro, and it was kind of just for people to share challenges and wins and just also to know what's going on, right? Hey, what was hard in your week? Because, we specifically, you sometimes get so time boxed into meetings, and really for people to just sometimes vent is super helpful. So, and I found that's a good way to close the week.
Yes, I have to be careful because those meetings are recorded. So we try to make sure that's not happening during our vent sessions, but I totally understand, and it's important to have a platform for folks to be able to express that because I do it all the time with my boss who's sitting in the room next door.
Yeah, look, that is, who doesn't? Well, look, Jamie, I think we're coming to the end here. Thank you so much for sharing a little bit about, what you do and what you've accomplished. I mean, it's incredibly impressive. And again, there's not many people that run a 100-year-old startup. So hats off to you. And thanks again for your time.
Yeah, absolutely. It's been a pleasure. Thanks, Frederik.
Awesome.